one or the other? So I would love my child to go to a good school, and good schools come at a cost. UPE schools you can pay 20,000 and your child is sorted out. So from my salary I probably can afford to pay for all my children in a UPE school.
It's against this backdrop that doctors are seeking better remuneration. However, critics say government continues to push the plight of medical doctors to the back burners, putting lives especially of the underclass at risk. According to a senior economist, Dr. Fred Muhumuza, government needs to find a holistic solution that will address salary disparities in the entire public service sector.
A normal person average in Uganda should be earning not less than $250. Those are the normal ones at the bottom of the pyramid. So you want to lift your doctors, even for comparison purposes, for welfare purposes, for focus to do their work, nothing less than $2,000.
Looking at the economy outlook, things are not very good. So where will this money come from, even if government could have a will to increase salaries of the doctors, teachers, and others?
The president had already talked about those entities, agencies in government, but also within the mainstream of government itself, you need to be thinking of trimming down. Which ministries should I merge? And one minister, you can keep the technical teams, the ones that you really need.
I think reprioritization and knowing what is important for us is very important, because if you look at the allocation of resources, we have a huge chunk of the resources going to the roads. Who are these people going to use the road if actually the doctors are not facilitated to keep Ugandan healthy? If the education sector is not actually well facilitated to keep the children and train them for the job market that we have in this country.
Mumuza further opines that the problem of salary disparities and inequities is far too complex to be handled by a salary review commission, which was set up by government.
It will just come up with recommendations that either will not be accepted, or if they are accepted, only for 1 year, and you are back at the same problem. So it's a deeper-seated problem. It's a cancer that has been eating into the system, and it is time to deal with the underlying issues, not just these symptoms. These are symptoms, and we don't want to use the medical jargon to deal with the symptoms and forget the disease.
The doctors are currently demanding 8.5 million shillings for the lowest paid and 48 million shillings for the senior consultants in various fields of specialization. However, the senior economist believes the increment cannot be done in one financial year.
They need to climb down a bit, but we need to give them assurance that we are going to get there. Now, to do that, you need to work in structures that give them confidence. A lot of people have lost confidence in government systems.
The analysts also believe government has the ability to address the problem.
No? Even things that do not meet the requirement of a supplementary budget, we've seen this supplementary budget pass. So if doctors are asking for resources and have refused to work, the only thing that government can do is to prioritize their need and pass a supplementary budget to provide for resources to actually address their need.
On Thursday evening, government warned doctors against striking and instructed RDCs to ensure they blacklist all doctors who will not comply. Experts find this inappropriate while trying to resolve the problem.
If this was slashing this compound, you can tell everybody slash. Whether you have slapped them or they will slash. A doctor needs to be happy and comfortable. So let's climb down the ladder, tone down the language of communication.
What are the dangers of government failure to fulfill the promises they make to the public servants?
When the prosecutors went on their earlier strike, government promised them. They gave 3 months. Government didn't deliver. Now, that becomes the culture that you cannot be trusted.
Sudhir Ruhanga, NTV.